Healthy Nation. Your health, your wealth.
It is now 6 p.m. and by the time it's 8:30 tonight, one woman would have died from cervical cancer. This is the reality of one of the biggest killers of Kenyan women. This is Healthy Nation, and I'm Janet Mbogwa. So excited to have you with us. And tonight we are discussing cervical cancer, a disease we know how to prevent, detect, and treat, and yet it continues to take Kenyan women from us far too soon. But first, we're going to look at a pulse check. Let's listen to that and then come back and continue this conversation.
I just found out it's stage 4. Cervical cancer. If you develop abnormal cells, I just found out it's stage 4. Cervical cancer. If you develop abnormal cells today, it takes about 8 to 10 years for you to develop the cancer.
Cervical cancer is mainly caused by the HPV virus.
That having multiple sexual partners or having a partner who has multiple sexual partners increases your risk of getting HPV.
It was in 2010. I normally tell myself like that was my darkest year in my life because that is the year I lost my marriage because of the abnormal discharge.
It was initially attributed to her periods. But later that year, she started to have abdominal pain as well.
The first thing in my mind was, I just need to kill myself.
Screening should start at the age of 21 with a pap smear and have it done every 3 years.
Protect yourself.
Right. So that pulse check just gives us a look into the conversations that are happening online, and they're global and they're painful. And these are the realities we're bringing with us today. Right. So I want us to now take a look at the data. Let's go into the data. And I also want you all to keep sending your thoughts, right, using the hashtag HealthyNationNTV. We're going to be reading some of your comments throughout this conversation. You can talk to us. You can talk to us throughout this show about your own story or somebody's story that you know of. But first, let's take a look at the data, because the data really grounds us in the numbers that we're seeing. So the first one there talks about cervical cancer by numbers. In Kenya, 5,845 new cases annually, 3,591 deaths annually, and 53 women per 100,000 affected. We have a doctor in studio. She's going to come and verify a lot of this for us as well. Let's keep going. Global, 2.29 million women living with cervical cancer, 1.81 million deaths, 40 women per 100,000 affected, right? So cervical cancer is the second most common cancer affecting women after breast cancer, but leads to more deaths. Let's take a look at the other data point that we have here. An African picture, 125,699 new cases annually, 80,614 deaths annually, 40 women per 100,000 affected. That's the picture in Africa, right? Now, the burden of cervical cancer in Kenya. Let's look at the counties that are identified as high risk. Let's take a really close look at this. Embu, Meru, Machakos, Mombasa, Nyeri, Kiambu, Kakamega, Nairobi, and Bomet. High risk. Let's take a look at some of the other categories. Have Kenyan women been screened? Screening is something we'll touch on a lot in this hour. Only 17% of women have ever been screened. Urban areas, 20%, rural, 14%. That's a pretty low number for a disease that is claiming so many. Highest screening uptake, though, in Nyeri, 32%, Kericho, 27%, Nairobi, 25%, Homa Bay, 24%, and Kisumu, 23%. Oof. And then let's look at the lowest screening uptake. This is pretty concerning. Mandera, Marsabit, both of them at 1%. Garissa and Wajir, 2%. West Pokot, 3%. More than 8 in 10 women in Kenya have never been screened for cervical cancer. Let's sit with some of these details. And then we look at the treatment capacity. 10 county-level chemotherapy centers established, 10 radiotherapy machines nationwide, and a look at the brachytherapy machines nationwide. Again, 6 of those. So you've heard the scale of the burden. That is the treatment capacity. And I think that's where some of the gaps lie. And then here's a look at the counties that have oncology centers: Nairobi, Uasin Gishu, Mombasa, Garissa, Nakuru, and Nyeri. Only a fraction of Kenya's counties have dedicated oncology service. This is, of course, some of the data available from KDHS. And then finally, we talk about referral pathways. We have Kenyatta National Hospital, Kenyatta University Teaching, Referral and Research Hospital, and Moi Teaching and Referral Hospital. So you've seen the burden vis-a-vis the intervention, vis-a-vis how many people are able to access treatment. And in studio, we're going to unpack this with 2 people. One of them is Judy Wanyoike. She's about to share her own story of being a survivor of cervical cancer. And then we have Dr. Yvonne Wekesa. She is a gynecologic oncologist. I know I said that right, Dr. Proud of me? Good. And she'll explain why it's important that people like her exist in that specific craft in what they do. Thank you both so much for being here. Right? Thank you for being here. Judy, I want to start with you. And earlier we've been talking with Judy and Daktari. I've had some time to also sit with Judy just to get her story. But Judy, talk to us about the first time ulijua uko na ugonjwa, when you knew something was wrong and what was happening in your body.
Kama vile nilisema, kwa majina naitwa Judy Wanyoike. Ndio nigundue mimi ni mgonjwa. One thing, nilikuwa na bleed sana. Ni wakati wangu wa kupata damu ya mwezi, ilikuwa inaenda 2 weeks. Alafu kitu ingine, nilikuwa tukiwa na mzee, nilikuwa nasikia uchungu. Na nilikuwa natoa discharge. Yes.
Na hiyo iliendelea for how long?
Nikaa kama mwaka mzima.
Mwaka mzima. Na hata ulinielezea ulikuwa unazimia sometimes, like you would even faint.
Bereni vile nilikuwa napata hiyo discharge, haikuwa hiyo uchungu haikuwa imeendelea sana. Lakini vile nilikuwa nikiendelea, hiyo uchungu ilikuwa inaendelea. Tuseme kama sasa hii discharge nilikaa kama miaka 2 hivyo. Lakini ndio nikuje kujua mimi ni mgonjwa. Mwaka mzima nilikuwa na uchungu sana. Kwa sababu kuna wakati nilikuwa nasikia uchungu kama ya mtoto. In fact, hata nilikuwa nasikia kama nitapata, kuna kitu ninagojea kupata. Sababu nilikuwa nasikia uchungu hadi nazimia.
Daktari, I'd still also want you to come in very briefly. Judy saying, like that pain that feels like labor pain. Is that something that's quite common? Or is that advanced? Yeah.
Yes, thank you, Janet, for having me on the show. So, first of all, I would like to say the early signs of cervical cancer are quite similar to other problems that women face with other conditions. So you might ignore them because, heavy bleeding could be due to other things like fibroids. Discharge could be due to other things like infections. And so most of the early signs of cervical cancer actually mimic other conditions, which would explain why most patients would not be thinking about cancer when they first have these symptoms. So again, the pain can be quite severe because as you say, the cancer is a tumor that grows and sort of presses on the nearby structures. And so therefore you can present with the severe pain. But also you could have the fainting episodes just from the heavy bleeding. Yeah, so it is important that any abnormal bleeding that is out of your normal menstrual period, so heavy bleeding, intermenstrual bleeding, which means bleeding in between your normal periods, and also any foul smelling discharge, and all of that.
Make sure it's checked.
Make sure it's checked.
Okay.
Make sure it's not just written off as,
Yeah.
as hormonal imbalance.
We'll come back and get into a deep dive, and thank you for painting that picture. I really wanted you to link it to what Judy has explained, and that's shocking to know it can present as that.
Yeah.
So Judy, ulienda hospitali, si ndio? After one year. Ulikuwa unanielezea ilikuwa through kanisa, si ndio? Talk to us about that. How did you now know sahi lazima niende screening?
Kwanza wakati nilikuwa naenda hospitali pale kwetu Dadora, nilikuwa natumwa Kenyatta. Na vile nilikuwa natumwa Kenyatta sikuwa naenda. Wacha niseme ni kuignore. Sababu kama ningekuwa serious ningekuwa nimeenda hospitali. Lakini ndio nikuja sasa kwenda kwa screening. Nilipata nafasi ya kwenda na kanisa ya deliverance. Kwenda na kanisa nikapata yule bishop, bibi yake alikuwa ameuliwa na cervical cancer. So mkienda pale kwa seminar ya wamama analeta watu wa kufanyia watu screening. So vile alitangaza hivyo, mimi nilikuwa wa kwanza kwenda kufanyiwa screening. Kwenda kufanyiwa screening nikapatikana niko na shida. Nikaambiwa nisijaribu kulala pale. Nirudi Kenyatta. Na ukumbuke nilikuwa natumwa nikiwa hapa Dadora na kosa fare ya kwenda Kenyatta. Na saa hiyo niko Nakuru na bado wananituma Kenyatta. So vile niliambiwa nisilale, nililala tu sababu singeenda kutafuta viongozi niwaambie vile nimeambiwa. So vile nililala asubuhi yake ndio nikaambia Charity, nikamwambia unajua jana nilienda kufanywa screening, na vile nilienda kufanywa screening nilikuwa nimeambiwa hadi nisilale hapa. Na usiambie mtu. So nilikuwa nataka anisaidie vile nitakuja Kenyatta akiwa peke yake, lakini yeye aliambia watu. Akaambia watu na wakanichangia nikapata fare sababu tulikuwa tumeenda na magari za kanisa. Wakanichangia fare na nikakuja nikapatiwa mama mmoja akanileta hapa Kenyatta. Kukuja hapa Kenyatta nikafanyiwa pap smear. Kufanyiwa pap smear ikaonekana ni ukweli niko na shida. So ikasemekana lazima nifanyiwe biopsy. Bado nikafanyiwa biopsy na biopsy ikatoa niko na shida, niko na cancer stage 2B. So unaona kama wakati nilijua mimi ni mgonjwa kama saa hiyo ndio nienda nikafanyiwa screening, pengine singejipata pale nilijipata. Lakini sababu ya kutojua ama kuignore ndio maana nilijipata pale nilijipata. So nikaanza safari ya vile sasa ilipatikana niko stage 2B, sasa ikasemekana lazima sasa nianze process. Wakati ule lazima kwanza ugeenda kwa theater. So na sikuwa na kadi ya NHIF. Ilibidi kwanza wale watu bado wanichangie tulipe kadi ya NHIF. Nikalipiwa kadi ya NHIF na lazima ugegojea. So nikagojea. Wakati ule ulikuwa mwezi wa pili, nikagojea hadi kafika mwezi wa 8. So theater niliingia mwezi wa 8. Nikaenda theater na nikatolewa nyumba ya mtoto, nikapoteza nyumba ya mtoto na offer zote. Alafu sasa nikaenda chemo na radio. Yes.
Radio na chemo ama?
Nienda chemo, radio na brachytherapy.
Okay. Kwa muda gani?
Hiyo muda tuseme nilitumia sasa ni 2012, 2013.
And before daktari aingie, ulikuwa unasikiaje Judy, like umepitia hizi vitu zote, umesema what is it, is it a hysterectomy? Yes. Hysterectomy? Sahi bado uko na familia. Walikuwa wanaelewa ama ulikuwa unafanya tu peke yako kwa experience hizi vitu zote? Support ulikuwa nayo?
Sana sana kesa kansa inakuaga, sijui inakuaga aje, sababu saa zingine ukipatikana na ile shida watu wengi huwa marafiki wanapotea. Saa zingine unajipata hadi familia saa zingine, lakini tuseme Mungu aliingilia kati sababu wale watu wa kanisa walisimama sana na mimi. Yes.
Okay. Doc, I want to bring you in. You've talked to us about cervical cancer. Now you're hearing Judy's story by the time she got the biopsy result and had to go through a hysterectomy. What is that like for a lot of people? You know, she said if she had done the screening earlier, it would have been something that would have been caught. But is her journey something similar to what you've seen a lot of people get? Is that the standard, or sometimes are people able to, not have to go all the way to getting a hysterectomy?
Absolutely. I feel like there are many barriers to access of screening and treatment for women with cervical cancer. I know we now have the national, the SHA, which covers part of the treatment of cervical cancer, but we really have to emphasize the part of screening. And even when screening is free in some places, you still have to factor in the hidden costs of transport to the facility, the hidden costs of losing a whole day of wages because you're in hospital queuing up. There are so many patients waiting as well. So when a person has to choose between food on the table and queuing the whole day, or paying $2,000 for a pap smear, really the choice is not that hard. They will choose the food. Mm-hmm. So for me, the challenges that Judy is describing are quite common. There are very many patients who are aware that there's screening, there's treatment, but they just simply cannot access the facilities because of either some hardships to do with transport, to do with who is going to take care of my child today while I'm in hospital, to do with the socioeconomic circumstances.
We have to stand in that gap somehow. Maybe by the time towards the end of this conversation, the call to action is, how do we stand in the gap that screening is beyond somebody has arrived for the screening? There's all of those other factors that are unique to us. But Judy's scenario, is that how a lot of women show up at your office, Daktari?
Yes.
You see a lot of patients in different stages. But is the most common one how Judy is when things are already so dire?
So we have cancer is we have different stages of cervical cancer. In our country, most of the patients present at an advanced stage. So we have only maybe 10% who present as early cervical cancer that can get cured, but then over 70% will present stage 2, 3, 4, which is a bit more difficult to completely cure. So yes, because of the challenges that Judy has expressed, we have most of our patients present at a later stage.
Which is so unfortunate, because I think that's what we're trying to do, is improve the screening. So Judy, sasa ulikuwa umeenda kwa hospitali, operation was done, sai sasa umeenda kwa stage ya kuheal. Talk to us about your journey ya healing. How has it been from then till now? Difficulties gani kwa mwili yako? What's that healing journey been like?
Tuseme wakati umepata hiyo ugonjwa, challenges ni mingi sana. Sababu sana kwanza mimi ndio nikuje kujua mimi ni mgonjwa, nilikuwa na 38 years wakati huo. So ujue watoto wangu ni wako wakubwa sana, walikuwa wadogo. Kuna watoto wanahitaji kusoma na tunahitaji kukura. Na saa unajua maisha vile iko. So unapata saa zingine watoto hawakusoma. Kama wakati ule nilikuwa na kijana alikuwa form 4, my firstborn. Huyo kijana vile alifanya mtihani, akifanya mtihani ndio nilikuwa kwa ward. Huyo kijana alikuwa mwerefu na ikawa hata nilikuwa nagojea ataingia university. Lakini vile sasa alisikia mimi ni mgonjwa. Vile alifanya form 4 aliingilia madawa. Akaanza kunywa madawa, mabangi, yani alikunywa kila kitu, na alikuwa kijana mzuri sana. Hadi wa leo hajalikafa. Na nikiangalia kwangu mimi naona ile shida ndio iliingiza yule kijana pale.
Ni kama alikuwa ame lose hope.
Ali lose hope. Sababu alikuwa anajua nitaweza kumsomesha, na sasa nimegojeka. Na hana tegemeo ingine. Sasa yeye alibidi kukaa akiwa mlevi. Akaona afadhali akaa hivyo. So ni ukweli sikuweza kumpeleka akuendelea na masomo.
Na watoto wengine na mzee?
Mzee naye vile aliona vile niko yeye ali lose hope na akaenda ushago. Akaniacha Nairobi. Nikawa niko na watoto wengine, niko na watoto kwanza wakati huo nilikuwa na mtoto alikuwa na 5 years. Na anahitaji kusoma na sasa unasikia baba yao alienda ushago. Sasa ni mimi nahitaji kwenda hospitali, nahitaji kupatia hawa watoto chakula vitu kama hizo.
Alafu pia ulikuwa umenielezea pia wajukuu sasa ndio waliingia tena.
Sababu huu kijana vile alifanya vile sasa aliingilia hiyo madawa na nini, sijui walipatana wapi na msichana, na akaenda akaniletea msichana. Vile msichana alipata mimba, yeye alileta msichana kwangu. Msichana wa wenyewe akakuja kwangu, singeweza kumfukuza, tukakaa na yeye akapata mtoto. Baada ya miaka 2 sijui tena wakapatana, na ako kwangu akapata mtoto mwingine, na alipata mtoto wako na kasora ilikuwa na
cleft lip.
Cleft lip. So msichana naye vile aliona mtoto vile yako sasa, naye akarus hope. Na unajua ile bado ujua kuna mashida yako nayo, sababu si alikuwa anahitaji kukaa na bwana yake, na huyu bwana mwenye alikuwa anatarajia kukaa na bwana mzuri akapata. So masida sida inaletwa na ingine zinafurutana hivyo.
Pole sana, Judy. Daktari, again, want to bring you in now. I know that, soon we'll take a break and come back and talk about treatment and everything. But talk to us about this issue around abandonment, or the journey that you see a lot of patients go through. Is it common that there's little to no support? Judy is somebody we met through a support group. So we know support groups exist through different chapters and hospitals. But when it comes to family, friends, relatives, is this a common thing that you see at your door, or is it different depending on the patient?
Abandonment of women, especially with cervical cancer, is quite a major factor that we see every day, and particularly it's because of how the patient presents. So the presentation usually is heavy bleeding, is bleeding after intimacy, is foul-smelling discharge. All of these things do not, you find that their partners will, at some point, either they are very supportive or they completely abandon them. So this is something we see quite commonly. And also we see, because of the economic challenges that the burden that is put on the family, we also see the abandonment from there, because now, when somebody is told there's cancer, they will exit. So personally, I feel like we need to encourage our communities, our families, our partners, that this is something, there's a very, I would say, important link between family support and treatment. There's a very important link between the support that somebody gets from their home and actually whether they will go through the journey of treatment and cure. So that is something that we need to work on as well. Yeah.
Thank you for speaking to how cervical cancer presents.
Yeah.
Talking about the bleeding, the discharge, the smell. I think it's important. I wanted to ask whether you talked about how sometimes there are things which are normal in the woman's body and things which are not. Because there's blood, we menstruate,
Yes.
there's discharge. So when it comes to things like that, when is it a cause of concern rather than something that's normal?
So, like I said, we have, once we get our first menstrual period, we kind of expect a certain pattern with your periods. So, my period is 28-day cycle. It comes for 3 to 4 days. I usually use 3 to 4 pads a day or something like that. And so if anything changes, even if eventually you realize it's due to hormonal imbalance or anything like that, but if anything changes along the way, you need to get it looked into. So anything that contributes to, heavy bleeding, intermenstrual bleeding, meaning you have bleeding in between your periods, if you have bleeding after any episode of intimacy, if you have bleeding after menopause, any bleeding after menopause is abnormal. So all this need to be looked into.
Okay.
And when I say looked into, I mean you actually need to go into a gynae's clinic
And be checked.
and be checked with a speculum,
Speculum.
a vaginal
Okay.
examination. Exactly.
Let's come back after this break and talk about some of what I think are considered uncomfortable conversations, which we're now bringing into your living room,
Yeah.
you do need to get checked. You're a woman, and even towards the end, we'll say that. Our WhatsApp number is 0769 590 762. 0769 590 762. There's already some feedback. People asking about how often somebody should be screened, the difference between a pap smear and HPV testing. All really valid questions. We'll come back and continue our conversation with Dr. Wekesa and Judy to talk about cervical cancer. First, let's take a look at the highlights.
Your health, your wealth.
While Kenya sleeps, the nation's stories are already on the move. Every night, thousands of newspapers leave our presses, traveling across Kenya and the region, so they reach you on time. That same network that delivers the nation's newspapers on time now delivers your packages too. For businesses, for individuals, always on time. Nation Courier, built on the discipline of daily deadlines.
This week on Twende, we are heading to Kenya's far north. To a county so vast, it feels like an entire country. A place where deserts meet forests. Where sand dunes continually change the landscape. Where volcanic mountains rise above endless plains. Where the past is well preserved.
Kabisa, huu ni mti. You can even see the rings.
Where islands float on a desert lake. And where wildlife found almost nowhere else on earth still survives. Marsabit feels like Kenya in miniature form. This is Marsabit, like you've never seen it before. Travel with us through the expansive county, only on NTV.
Twende, brought to you by Kenya Wildlife Service.
Daktari ameniambia kuwa wewe ndio ulimleta huyu msichana hapa akiwa hali mahututi.
Yeah, mimi nimemleta. What's she doing in a place like this?
I couldn't sleep. I couldn't eat.
Has Mine said anything? Umesahau Mine came here unconscious.
Mbona pila naleta na Juno ole boys?
Niko na shida naye tena kubwa sana. Wewe ujiondoa hapa na mimi bado nakuuliza maswali.
Welcome to the Pepsi Football Nation.
Football is officially classified as cinema.
Vinicius Jr., Dribblator 3.
Rule 100, everything gets settled on the pitch. What rule would you want?
Are you a young dreamer, creator, and entrepreneur? Your ambition is about to meet its perfect match. Join us at KICC on the 15th and 16th of July for Skill Up Africa 2026 and discover AI and digital skills that will define the future of work. The gates are open, the opportunities are massive, and entry is absolutely free. See you there.
Rada gani?
Rada?
Hey, rada.
Is that plastic in a billboard?
West ni pesa bro. Sasa nikwambie, hii billboard I think ukipiga hesabu ama ukiinvestigate hivi utapata maybe in total inakuja like around 1.5 tons. Hizi ni viti, hizi ni masahani, ukiweza kuzimelt, clean, recycle. We have to think of waste in terms of how do I take this thing, repurpose it and continue to use it.
Hii ni Atois mtaani na
tunataka rada safi. Rada safi.
This is NTV.
yajayo katika NTV Wikendi.
Vijana, mauaji si ya maana, vita si vya maana, kumwaga damu haina maana, haijengi yoyote.
Polisi wanamtaka mbunge wa Nyaribari Chache kufika katika afisi za DCI kufuatia shambulizi lililotekelezwa na wahuni Jumaa dhidi ya msafara wa Linda Mwananchi huko Keumbu. Mtu mmoja aliaga dunia na wengine kadhaa kujeruhiwa.
Wananchi wanajua ni nani wa kufanya, ni nani wa kuongea. Sisi tutashirikiana na mimi nitasimama kidete. Siwezi kukubali siasa ya kugawanya Kenya.
Rais William Ruto atetea hazina mpya ya kitaifa ya miundombinu kwa mara nyingine kuwashtumu viongozi upinzani kwa madai ya kuendeleza siasa za mgawanyiko.
People are now coming back. Those who have fled the area are coming now in mass. Mass.
Shule ya upili ya Yatia huko Baringo Kaskazini yapokea basi la kwanza kabisa, ishara ya utulivu kufuatia mashambulizi ya kijahili ya mara kwa mara. Na tunaye seneta wa Busia Okiya Omtata mubashara. Je, angali na nia ya kuwania urais mwaka ujao?
This week on Twende, we are heading to Kenya's far north. To a county so vast it feels like an entire country. A place where deserts meet forest. Where sand dunes continually change the landscape. Where volcanic mountains rise above endless plains. Where the past is well preserved.
Kabisa, huu ni mti. You can even see the rings.
Where islands float on a desert lake. And where wildlife found almost nowhere else on earth still survives. Marsabit feels like Kenya in miniature form. This is Marsabit, like you've never seen it before. Travel with us through the expansive county, only on NTV.
Twende, brought to you by Kenya Wildlife Service.
You feel that? The crash zone.
Crash what?
The crash zone. It builds suspense, uncovers evidence, foreshadows danger. You feel it now?
Oh yeah.
I guess I'll go and try and find a ladder.
Healthy Nation. Your health, your wealth.
This is Healthy Nation. We take some of the biggest health conversations and say them out loud because your health is your wealth. I'm Janet Bogwa. We're in studio with Judy Wanyweke and Dr. Yvonne Wekesa. We're talking about cervical cancer, which is a cancer that a lot of us must know about, must pay attention to, and must be screened for. A bit of feedback here. So I'll ask Daktari a few questions and then we'll come back and talk to Judy about how she's coping now. So somebody had asked, how often should a woman be screened? Had you mentioned that? I know somebody had mentioned it, I think, in our pulse check. Mm-hmm. Yes, I think the pulse check said once every 3 years. Is that correct?
Yes, so we have various screening tests. So the pap smear can be done every 3 years. As long as it's normal, it can be done every 3 years. But then we have something called the core testing, which is 2 tests in one, where we do a pap smear plus HPV sampling. So we check for the HPV virus itself. So if you're able to do a pap smear plus HPV, then you can do it every 5 years. You don't need, yes, you can come in after every 5 years. We also have some other less sensitive tests that can be done, that are even currently being done in our health centers, facilities, called the visual tests. Mm-hmm. So you'll hear something like visual inspection with acetic acid. They just put vinegar on the cervix, and then they are able to immediately see whether there are any changes, and then based on that, they will refer you to a higher test or a higher center. So those ones are also being done. Mm-hmm. So there should be no excuse for any form of screening being done in the health facilities.
They put vinegar.
Yes.
Is that something that started happening recently? Has it always been there?
It's always been there.
Okay.
Yes.
It sounds like a much more accessible thing to do, but is it just not as efficient?
It is very effective. The only issue, it is user dependent because it depends on who's doing it, seeing the changes and being able to recognize that these changes are abnormal. So it's not as specific as the other tests that we're talking about, the pap smear and the HPV.
And speaking of the HPV testing and vaccine, how soon are you supposed to get an HPV vaccine? This is something we've talked about outside of this broadcast and during the break. It's supposed to be girls and boys.
Yes.
First, talk to us about how often and when should one start getting an HPV vaccine?
So there's the studies actually that informed the change of when you should get the HPV vaccine and how many doses was actually done in Kenya. So this is a study that is called the Kenshi study that was recently done that showed that just 1 dose of the HPV vaccine is just as effective in preventing cervical cancer. So this HPV vaccine should be given to girls and boys at the age of 9 to 14. That is when we start giving 9 to 14. And this age group is only, I would say it's a rough estimate because this is when we believe that children have not started,
being sexually active.
Exactly. But ideally, you can also tailor this to different communities and alter that age, But the 9 to 14 is a general guideline just to try and catch these girls and boys before the age of sexual debut.
There's still 1 or 2 more questions. I'll get to them, but we've just talked about it for girls. And something here, there's a study here that says in the US, UK, and Australia, boys are routinely vaccinated against HPV because men carry and transmit the virus. A 2025 global study found that 53% of countries with HPV programs now vaccinate boys. But in Kenya, it's only girls that are vaccinated.
Yes.
Is that true?
Yes.
We have no program that targets vaccinating boys as well.
So Janet, you have to understand that the program to vaccinate girls is based on a public health initiative to try and catch the people who are most affected by HPV. So HPV vaccine is not just a cervical cancer preventing vaccine. It is a cancer preventing vaccine in that HPV does not only cause cervical cancer, it causes other cancers like oral cancers, throat cancers, anal cancer, penile cancers, vulval, vaginal. So there's a vast majority of cancers that are caused by HPV. But cervical cancer is the one that is quite devastating in terms of morbidity and mortality. And so it makes sense for the country to focus on the girls first. But in countries where they have the resources, then you can roll out the vaccination to boys. But the only thing I would say about that is even in this country, we are able to give vaccination to boys. The only difference is that you'll have to pay for it because the government one that is free is only targeting the girls because of what I've talked about. But ideally, if you went in with your boy between the ages of 9 to 14 and asked for the vaccine and paid for it, you'd be able to vaccinate them.
I really hope we're listening to this because I feel like for as much information and awareness we have around cancer matters, there's always these in-between conversations that we don't have out loud, and I think that's one of them. Before we continue with feedback, Judy, let me come to you. How are you feeling today? Is there still, kuna dawa bado unatumia? Are you still struggling with the effects of cervical cancer? Talk to us about how you're doing today.
Kwa saa hii hakuna dawa natumia sababu ya cervical. Ile dawa natumia ni ya maumivu ingine. Lakini kwa saa hii ile shida niko nayo ni shida ya kifua. Kuna wakati nilifanyiwa PET scan. Nikafanyiwa PET scan huko KU, ikatoa niko na ufimbe kwa lungs. Nikatumwa picha ya CT scan. Lakini sikuweza kwenda hiyo CT scan. Hii 2025 bado nikaenda mwezi wa 8 nikaenda PET scan bado sababu kifua bado ilikuwa inanisumbua. Nikatumwa hiyo picha na bado sijaenda hiyo picha, so nakunywa tu madawa ya uchungu. Yes.
Mbona hujarudi?
Sijarudi sababu hiyo picha kuna pesa ninalipiwa na saa na kuna pesa ninafaa niongeze. So hiyo pesa ndio sina, ndio maana sijarudi.
Are you able to weigh in? Let's work backwards. The SHA coverage.
Absolutely.
And any comment you can make on that, because Judy is not the first person who's had this conversation with us. I know that even during Fixing the Nation, we posted somebody who was talking about this. There were so many survivors of cancer who had said, it doesn't cover. Comment about that, and then maybe we can talk to Judy a little bit about what is supposed to be happening in terms of the treatment. Because I think during the break you were saying, but what medication were you getting? Let's work backwards. Talk to us about SHA.
Yeah. So SHA has helped a lot in terms of provision of radiotherapy, chemotherapy, and the surgeries that are needed for cervical cancer. But you have to understand that way before we get to the treatment part, we have the screening part, we have the investigation part, and then we have then you get to the treatment. So as far as I'm concerned, where there's a lot of screening, the pap smears, the HPV DNA that is not covered by SHA. And then we also have the imaging that we do, the X-rays, the CT scans, the MRIs, that help the doctors to be able to stage the cancer correctly so that we can be able to give the appropriate treatment. So most of these are not fully covered by SHA. Most of the patients have to top up, and that is quite a burden. So we've seen a lot of patients get lost in the follow-up window because you send them for an MRI, you see them back 1 year later. And meanwhile, the cancer is progressing, and we see this very, very often. So as much as it's a good thing that SHA is covering radiotherapy and chemotherapy and surgeries, we also need to look into how to support women in terms of imaging, because without the imaging, we cannot start treatment. And also the initial screening, if that could be fully covered, that would be a very big step in the right direction. The other thing I would say is after the whole treatment has been done, we need to be able to follow up these patients for 5 years, at least 5 years. So for most of the cancers, especially cervical cancer, we have to follow you up for 5 years after treatment to be able to say either we have cleared you, you're in remission, or we need to do further. So I would ask Judy what was happening in 5 years from the time of our diagnosis, treatment, and then the follow-up. Because ideally, you're supposed to come in every 4 months for the first 2 years, and then every 6 months for another 3 years. And during these visits, we are able to examine you, we're able to do some imaging, we're able to do certain tests to be sure that either we completely cleared the cancer or it's not coming back. Yeah.
Wakati nilikuwa naenda clinic, kama vile nilikuwa naambiwa niende clinic, but ukumbuke kuna wakati hata unahitaji kwenda hiyo clinic, saa zingine unapata hauna fare. Na kwa ile clinic bado ukienda, kuna wakati unahitajika, kuna picha umetumwa. Kama vile nimetumwa picha, na hiyo picha ukitumwa unahitaji utoe pesa kwa mfuko. Saa zingine huna hiyo pesa. Na ujue ukikosa kwenda clinic, kama tuseme si nilikuwa nimeambiwa niende clinic Thursday, nikikosa kwenda hiyo Thursday, tuseme nimekosa fare nikose kwenda hiyo Thursday, itanifanya nirudi kwa hospitali ni book tena ndio nitumwe siku nyingine, unaona. So ikawa hata kuna wakati ilifika nikaachana na clinic.
Ilikuwa too much juu ya hiyo pesa kwenda kurudi. We really need to stand in the gap. You've talked about the insurance. Is there any way we can appeal to people watching and listening on how we can stand in that gap, or is it something that just needs to be addressed at a much higher level?
I think one of the things, so we have this cervical cancer elimination program that has been launched worldwide, but also has been launched in Kenya this year, that is trying to take the services closer to the people. And one of the key pillars of that is trying to get them to the community health workers to go to homes and get them to do self-sampling for screening. and also to try and get vaccinators going to schools, to homes, trying to get the services closer to the people.
Okay.
But that doesn't eliminate the need for support in terms of now the imaging, the X-rays, the CT scans, the MRIs, and the transport to come to hospital for the follow-ups, because that's a great burden for most of our women.
You said there's a kit. Tori, talk to us. Is there something like that people can access that
Absolutely.
They can use at home?
Yes, we do have a self-sampling kit that we can give you, explain to you how it's used, and you can do it at the comfort of your home and just bring in the samples.
This was as of when? Has it been around for some time?
This has been around for a while. The only problem was the cost.
Okay.
Yeah, so it was only, if you can afford it, you can get it, but it's actually widely available.
What's the cost roughly?
So most labs would between 5,000 to 6,000.
Okay.
Yeah, which is out of reach.
Right, and
this is,
and if you're using this is the one that you do once every 3 years, or there's a frequency to using this kit?
This one is 5 years. The HPV DNA
5 years.
sampling. Exactly.
Okay, so for those with access, there's that option.
There's that option.
There's that option. Judy, sahi uko kwa support group. I think that's even how, and you're a CHP. Ulikuwa umesema now you've gone into giving back as a community health promoter. Kuna mwanamke anasikiza hii kipindi sahi. Ungependa kuongea na wanawake uambie nini kuhusu hii cervical cancer?
Kwanza sana umeniuliza kama niko na support group.
Yes.
Hata tuseme bereni singeweza kukuja pali kama hapa. Nilikuwa nimefika kiwango ya kujichukia na kukaa kwa nyumba ningoje siku yangu ya mwisho ifike. But uzuri nikapatana na hii group inaitwa Kirere Health. Kirere Health. Vile nilijuana na hiyo Kirere Health ndio ilimefanya nikuwe mtu. Sasa nikajikubali mimi ni mgonjwa, nilikuwa mgonjwa, na nikajikubali ninafaa kusimama mbele ya watu niwaambie, yani ninaweza ongea na wamama niwaambie wafanyiwe screening, sababu ukifanyiwa screening ujulikane wewe ni mgonjwa na hujafika ile kiwango ya ile ugonjwa kuitwa kansa, unaweza tibiwa na bado uendelee na kupata watoto. Kama mimi sikuwa nimetoseka na kupata watoto, but nilijipata siwezi nikapata mtoto sababu nimetolewa hizo nini. So unaweza abia wamama wafanyiwe screening. Na watoto wapate chanjo. Sababu wacha nikuambie hii ugonjwa iko na burden. Hii ugonjwa si hata mimi bereni nilikuwa nafikiri hii ugonjwa inapatanga wale watu wako na pesa. Unaona, lakini nilikuja kugundua hii ugonjwa inaweza pata mtu yoyote. Sijawahi kaa hivyo nikafikiria naweza kuwa na ugonjwa kama hii. Na hii ugonjwa ubaya wake ikiingia kwa nyumba inawafanya mkuwe maskini. Watoto wako masomo inakatikia hapo. Unaona? So mimi naweza ongeleza wamama niwaambie wafanyiwe screening. Siwezi taka kuona mama mwingine kama mimi akipitia yale mambo napitia sahi. Sitaki kuona watoto wakiteseka kama vile watoto wangu waliingia kwa kuteseka. Na saa zingine ni kukosa hiyo kutojua, na hiyo screening naweza omba serikali wapeleke screening masinani. Wamama wanateseka. Na hiyo chanjo naweza shukuru sana serikali sababu hiyo chanjo kwa hospitali ya serikali ziko. Na kuna ombi nilikuwa nimeomba nikiwa pale kwa kitanda wakati nilikuwa mgonjwa, nikaambia Mungu akiniponya sitakuwa nikisikia aibu kuambia wamama wafanyiwe screening na watoto wapate chanjo. Na ndio Mungu akaniponya na nikasema sababu Mungu ameniinua tena nitakuwa community health promoter. Na kwa sasa mimi ni community health promoter. So na niko na household zenye naigianga, najaribu kuongea na wamama kwa machifu baraza, naenda kuongea na wamama ndio wakubali kwenda kwa screening na watoto wapate chanjo. Yes.
Asante Judy. I think you've spoken so beautifully. And for people to just hear, umesema vitu mingi, like saying you didn't know this could come into your home. Ukujua. Yeah, I don't know what it will take to get people to go to screening more. So, Daktari, even as we wind up, talk to us about availability of screening. There's people who are listening saying, mimi sina hizo pesa, or this is not for me. Maybe I'm in my 30s or 40s. Somebody was even asking, as a grown-up, can I get the vaccine, or is it too late for me? So let's kind of demystify these myths and facts. Screening, we know that sometimes there's free screenings across different places, but how can we encourage women to go for screening? How do you encourage the women that you work with, the women that you engage with, communities and beyond? What is it that they need to hear for them to know, okay, I need to take this seriously, I need to go for screening tomorrow?
I think we will lead with statistics, which is that up to 8 in 10 women, not really women, but up to 8 in 10 adults who have ever engaged in any sort of sexual activity have been infected by HPV. That's a big number. So 8 in 10 at some point in their lives will be infected by HPV. And HPV causes 99% of cervical cancer. So you cannot really shy away from looking at whether you are affected or infected in one way or another. So, and then out of this 8 in 10, about most people will clear the HPV virus within 2 years, but we don't know which people will clear the virus within 2 years. Yes?
Explain that. So if I get an HPV vaccine, should we use that scenario? No, you're not even going to the vaccine.
Infection.
The virus, sorry. Yes, you said virus, yes.
At some point when you get infected with the virus, you will clear it. If your immunity is okay and everything is okay, you will clear it within 2 years. You are expected to clear it within 2 years. But for some people, it will persist. Yes? And so in these people where the HPV virus persists, those are the ones that will now go on to form some changes in their cervix, and then which will lead to cervical cancer.
Okay, got it.
Now, this period of time from the time you get infected to the point where you're getting cervical cancer is about 10, 15, 20 years. It's not immediate. It is a very silent infection where you have no symptoms at all. And so in this 10, 15, 20 years, that is the time period where we are doing screening. Because you don't know you have it to begin with.
I don't know why that stressed me.
Yeah.
It has. The carriers are men, and they don't know that they are carriers.
That is not a very correct statement. So we both carry it, men and women. We both carry the HPV vaccine. It's just that the cervical cancer is more common
in women
than the other cancers that HPV causes. Like I said, HPV will also cause penile cancer, will also cause anal cancer, will cause throat cancer, oral cancers. But cervical cancer is more common and more likely to cause deaths and disability.
So what should women be doing? What should men be doing? We've talked at length about what women should be doing. Is there anything men need to be doing?
So both men and women need to be vaccinated.
Sorry, yeah. You know, I feel like I'm having a sidebar conversation with Daktari in my home. I need to remember I'm on air because I'm asking for confirmation on things she's already said. But okay, this is good. That's a good call to action. Men, women, get vaccinated. Children as well.
Yes.
Get vaccinated. I think that's a powerful. Any other one more thing that you think Kenyans need to know, Daktari, as we wind up? One more thing that you're like, they need to sit home with this particular message.
Cervical cancer, one of the myths I keep hearing, and when people come to the clinic is, I have cervical cancer. Did my husband give it to me, or did my partner give it to me? Cervical cancer is not a disease of promiscuity. It is not. The reality of the matter is whether you've had one partner, of course, having multiple partners increases the risk, but you only need one partner, one encounter to get HPV virus. You don't need to be having multiple partners for you to be infected. And so when you know that, then you realize that every one of us, 8 in 10 as we are sitting here, have at some point or will at some point be infected with HPV.
Okay, I think let's stop it there. Thank you so much, Dr. Yvonne Wekesa, for just breaking it down very simply and having a call to action to each and every one of us, men, women, and children. Judy, asante sana. Thank you for speaking to Kenyans today about your story. We wish you the best. I hope in a few months, Healthy Nation can call you back and you tell us about how you're doing. But here is my sign-off, right? And I want to leave you with this. 9 Kenyan women will die from cervical cancer today. Not from ignorance, not from bad luck, from a health cover that perhaps sometimes promises to pay for cancer treatment and doesn't. Judy has explained that. From a rumor about a vaccine that a doctor never got the chance to correct. We have the vaccine, we have the test, we have the plan. What we do not have is anyone willing to be held responsible for the gap between those two. If you're watching this, if you've never had a pap smear test, book one. If your daughter or son, as we continue to learn, hasn't had the HPV vaccine, ask why not, ask louder than whoever told you not to. If the woman sitting next to you doesn't know her status, have the conversation tonight. Because the next woman who dies from this disease may be someone you know. And increasingly in this country, that will not be an accident. It will be a decision someone made not to act. That is my sign-off. I'm Janet Bogwa. Thank you so much for staying with Healthy Nation. And let's continue to be in touch, continue to keep the communication going. But for now, let's take a break and we'll see you back here soon.
Healthy Nation. Your health, your wealth.